doing hand hygiene. Hi, I'm Elizabeth. I'll be your nurse today. Can you state your name and date of birth for me, please?
Sarah Spencer, June 13th, 1996.
Perfect, and I'm just going to check your wristbands. And do you go by Sarah?
Mhm.
Okay, perfect. Do you know the date?
It's July 31st, 2019.
Perfect. And where are we?
Danvers, Mass.
Awesome. So what brings you in today? Are you having any short of breath, any pain anywhere, any other concerns?
Nope, just like a wellness check.
Awesome. So I'm going to do a full head-to-toe assessment on you. I'll be talking out loud, just explaining what I'm doing. And if you have any questions along the way, just let me know.
Okay.
Perfect. So I'll start off by feeling your hair. It's not brittle or dry. It's nice. I don't feel any lumps, bruises, or lesions, so that's good. Just looking at your face, everything's symmetrical. Your eyes are symmetrical, ears symmetrical. I don't see any bruises, open wounds, or anything on your face. I'm just gonna check your reflexes with your pupils, make sure they're round, reactive to light, and I'll check your corneal light reflex as well. So if you just look straight ahead at me, I'm just gonna look at your pupils, okay? Good. Good. And I'm just gonna shine it right in the middle of your forehead. Okay. Just keep looking at me. Perfect. And your pupils constricted to about 2 to 3 centimeters and then went back to normal after, which is perfect. And now I'll test your cardinal gaze of field, your cardinal field of gaze. So just look straight at me, again with your head, and then follow the pen with your eyes. Awesome. So if you could just open your mouth for me and stick out your tongue. Great, your mucous membranes look pink and intact. There's no signs of thrush. Your teeth are intact as well, and nothing looks dry. Looks great. And now I'll just take a look at your nose, and just let me know if you feel any tenderness or pain while I'm doing it, all right?
Okay.
First, I'll feel your occipital in the back of your head, post-auricular, your post-cervical, pre-cervical, or anterior cervical, your pre-auricular, your parotid, tonsillary, submandibular, submental, and supraclavicular. And did you feel any pain or tenderness feeling those? Perfect, they felt normal. And if you could just shrug your shoulders for me, perfect, symmetrical strength, awesome. I'm just going to take a look at your arms if you could just put them out for me. I don't see any edema or swelling, everything's intact, your skin looks appropriate for your ethnicity. Could you feel me touching your arms? Perfect. And if you could just flip your arms over like this, I'm going to put my hands in the middle, just squeeze. Perfect. You have symmetrical strength on both sides. I'll just feel on your radial pulses. Feel normal. And then if you just put your fingers out like this, I'm just going to feel capillary refill, and it's less than 3 seconds, which is normal. And then if you flip your arms over again, I don't see any clubbing. Your fingers look normal. Your nails don't look brittle or anything. Perfect. Great. So now I'm just going to take a listen to your lungs, okay? So you have 6 sounds anterior, 2 lateral on both sides, and then 8 posterior. Just take a deep breath in and out, in and out. Good. Good. One more. Perfect. And then I'll just check this side. In and out. In and out. And then just the other side. Thank you. In and out. In. And then if you could just face back for me. In and out. Good. 2 more. And last one. Perfect. And you can just stay facing that way. I'm just going to do one more thing. So when I was listening, the bronchial sounds are louder on inspiration than expiration. The bronchiovestibular sounds are equal for inspiration and expiration, and the vestibular sounds are longer on expiration than inspiration. I'm just going to make sure, just do one more big deep breath in and out, And everything expands symmetrically and normal, so you're good for that. Thank you. You can just face me again. I'll just palpate your carotid pulses, and then I'll take a listen to your heart.
Okay.
Good. Good. I'm just going to listen with the bell, my stethoscope. Awesome. And I don't hear anything, which is normal. And then I'll palpate and listen to your apical pulse at your 5th intercostal space, mid-clavicular line. Good. Sounds normal. And then I'm just going to listen to your heart valves, all right?
Mhm.
So the first one I'm listening to is your aortic valve, and that's at the 2nd intercostal space on the right sternal border. And the second one is the pulmonic valve, the 2nd intercostal space on the left sternal border. And then Erb's point, which is the 3rd intercostal space on the left sternal border. And then I'll listen to your tricuspid valve, which is at your 4th intercostal space, the left sternal border. And your mitral valve, which is your 5th intercostal space in your mid-clavicular line. And now I'll listen to all the same spots with the bell just for murmurs or anything. And I don't hear any. Great. So now I'm just going to inspect your abdomen, make sure everything looks good. Just from looking at it, the skin is intact, like I said, for everything else, and it's appropriate for your ethnicity. I'm just going to listen to your bowel sounds in the 4 quadrants until I hear something. Good. And your bowel sounds are active, which is normal. And now I'll listen to your abdominal arteries with the bell. So first I'll listen to the aortic artery, the renal arteries, both sides, the iliac artery, and then your femoral arteries. Good. I don't hear anything, which is normal. And then I'm just going to palpate your abdomen. Just let me know if it's painful or tender, okay?
Mhm. Nope.
Nope, you're good. Perfect. No guarding when I was doing that, which is perfectly normal. And then if I just have you flip around, I'm just going to make sure
Oh.
that you don't feel any pain with your kidneys. Do you feel any pain or tenderness?
Mm-mm.
Perfect. And are you having normal bowel movements, passing gas regularly? And any pain on urination?
Nope.
Awesome. So lastly, I'm just going to take a look at your legs. Just by looking at them, I don't see any edema on your legs or feet. Yeah. Thank you. Can I just have you push against my hands, please? Thank you. And then pull back. Great. Now I'll do the same thing with your feet. Perfect. Top. Perfect. And then I'm just going to check your toe refill, which is less than 3 seconds, which is normal. And I'll feel your dorsalis pedis pulse. You can feel them on both sides. And then your tibialis posterior pulses, which I can feel on both sides as well. And do you have any questions?
Oh.
Perfect.